So it's a pleasure here to have Dr. Drew, a household name many of you are familiar with. Had the opportunity to meet you, Doc, earlier this year at a podcasting conference in LA.
That was
Moderate
fun.
a panel with you on it. A lot of fun. Appreciate how candid, how open you are. Taking the time to talk to me here. Want to begin, as I did there, by thanking you for teaching me and so many of us about the birds and the bees through Loveline back in the day.
And let me just frame that as I was 24 years old when I started doing that. It was because Dr. Fauci was out there beating the drum for us young physicians to go out and teach about this thing we had just started calling AIDS. And we had now a causative agent, which we called HTLV3 at the time. And had this opportunity to go on the radio. I thought, that kind of be fun, interesting. It was right up the street from me, and was blown away that young people had no understanding, no knowledge. No one was talking to them about any of this stuff. And I thought, oh my God, it's critical now that they hear about it. And it's so simple. And I know what they're up to. But we'd just been through the so-called sexual revolution, and the adults that foisted that on everybody never contemplated that adolescents would begin having sex. They just didn't plan for that. They didn't acknowledge it. It was weird to talk to young people about it. So no, I knew better. Believe me.
I have to tell you, I mean, my recollection is I'm a child of the 80s, born in the 80s. I remember health class in the early 90s. They took the boys to one room, the girls to another room.
Crazy.
And that was all I learned. It was like a couple hours on a Friday. And then, thankfully, I had you and Adam on the radio and on MTV to tell me about what was actually going on.
And mind you, that was already 14 years after I started, 12 to 14 years later, and it just was. My naive idea was, what would I have wanted? Because there was no, people don't appreciate now. There was no source for this information. I mean, literally, when I was a teenager, I wanted information. I had to go to my dad's medical books in his library in his office, and everything was shrouded in mystery and Latin, and it was just obscured. It was bizarre, and there was nowhere to go. Really.
And you were lucky, right? Your father was a doctor.
Yeah, it didn't help. You certainly couldn't go to him with stuff. Yeah.
Most of us didn't have medical books to access, and it was like pre-internet days. There was no internet. I mean, which has helped and hurt in certain cases. So we talk about history, we talk about culture, we talk about politics daily on the podcast. Love having your medical background here. When we were together over the summer, I asked you to diagnose the country, our culture.
Okay.
We're all on edge, so divided. Well, what you did say at the time, you're like, Moshe, it's narcissism. Our problem in this country is narcissism.
This is what Adam says constantly: is all roads lead to narcissism. All roads lead. That is, and then underneath narcissism is trauma. Yeah. So childhood trauma, particularly, and intergenerational trauma that's expressed through childhood injury. So,
but why do things seem worse? Are they worse, or is it just that we have social media and we have all this information, so it's all in our faces all the time? I mean, what we are on so on edge, and whether you could blame our politics or social media, what is your sense for why we are where we are as a country right now?
I mean, it's a massive question, right? And certainly there is no doubt that the screens have played a negative influence, right? I mean, we just add up the score. Let's just add up all the influences. So, and then that historical trends tend to happen. But here's our, the soil upon which these historical trends have emerged. Screens, clearly deleterious effect on the mental health of young people. There's just no doubt about that now. And we don't even know the full impact, frankly. We go through a pandemic where we tell kids in development, young children whose regulatory capacity is limited, that they need to shelter in place, which is what you say when there's an incoming nuclear weapon, and that if they don't shelter in place, they're going to kill their family. I mean, you're 9 years old and you hear that for 2 years, and you're restricted from access to your peers and your education? Are you effing kidding me? Like, how, of course it's going to have profound mental health consequences. And that those are the most extreme cases, but across the board, it adversely affected mental health. So we had that. We have substances at an extraordinary pitch right now. We have people, using wildly things that are hurting them. We have
so stop you right there. Drug legalization, bad, good?
I stay agnostic on that. Okay. It's having lots of serious medical consequences. I'll tell you that, but that's pretty predictable. But I don't make the law. The law is something that people decide on. But yeah, predictable. And I always hoped that I knew we would do this, and I don't have strong feelings about it, but I figured we would do it one day. That once we do it, we get honest about the consequences, and so we can deal with it and fund it. But of course not. Look at the streets of Los Angeles. That's all drug addiction, or at least 80% of it is. And we're letting these people just to die of a progressive illness that is well known to end in death. We just allow them to die, no problem. And we're running open air hospitals without doctors and nurses, which is beyond belief. We're asking social workers to run hospitals without walls. They have no training in this. They can't possibly. They're wonderful at what they do. They're not doctors. They're not nurses. And then we have childhood trauma, as I said, which has been an extraordinary pitch. It's childhood sexual abuse, childhood neglect, childhood physical abuse. I mean, it's all we heard about on Loveline day after day after day after day. Just case after case. And it was clear to me that there would be trauma is called narcissistic injury. That's what it's called. So, and then also I watched when I was working at the psychiatric hospital, I watched cluster B personalities take over the diagnostic sheets from where I arrived there in 1984. It was sort of, I guess it was 1985. There was a mix of personality disorders. By the 90s, it was all cluster B, all the narcissistic disorders. And then, of course, we've made access to mental health services more restrictive. We've condemned mutual aid societies. We've attacked 12-step, the things that free and can help people. Then just so many things have gone bad. And as a result, I wrote a book on narcissism, and I wanted to talk about scapegoating. I said, look, I can't find any periods of history where narcissism and childhood injury has been so pervasive, except pre-revolutionary France, and there are a couple other sort of more primitive cultures. I could see it too. And I said, there's going to be guillotines. And they didn't let me put that chapter in my book, The Mirror Effect, because it was too speculative. And of course, I didn't know of such a thing as social media or cancellation, and it came. And now we're in the cancellation, which is the guillotine. And people need to study their history, because
digital guillotine.
People that bring out the guillotine always end on the guillotine. It always comes for you. This is the part that people seem to miss. I'm seeing this a lot now. People going, I can't believe that the people that are so against the cancel culture are now using the cancel. Yeah, it's inevitable. It's inevitable. It's going to happen, and it's going to be bad. And it's the reign of terror. This is how that goes.
Wait, is that something? I mean, is the sense like what we saw recently with the university presidents from Harvard and Penn and MIT, the genocide remarks, them losing their jobs as the people who are at the forefront of DEI, sort of the reversal of that?
I mean, it's easy to say yes, but it's everybody. It's a reign of terror. I've actually gone on the record saying I don't want them to lose their job because I'm tired of this cancellation BS. I don't like it. I think they ought to. They're the board. I think the board has the board of these schools have to examine what the impact of all this is. And if that person is unable to do their job, then the board has to fire them from inadequate performance of the job. But for the mob, the mobs are what bother me. And so mobs are alive and well. And I knew that's how narcissists deal with their aggression. They form mobs and then they focus on a scapegoat. That's how they do it. It just still, even though I saw it coming, I'm still mind boggled. I'm still gobsmacked by how profound this has become. I never thought we'd see anti-Semitism like this again. I thought we kind of evolved past that. No, wild stuff.
Have humans evolved at all?
Well, I'm beginning to think that it's just context. There's no evolution. It's just context. And the effects of the printing press, not different than the effect of the internet. The humans are scurrying around, screwing themselves up just at a higher rate than we did when there was, when there was a printing press invented and the transmission was slower.
Right. Now everything is so quick. It's remarkable. Many people know you as this media personality, but you practice. Tell me, who are you practicing? What patients are you seeing these days? What is your focus medically right now?
So I'm severe workaholic. And I ended up doing a year as a chief resident and then teaching general medicine and ICU medicine and doing hospital and ICU care back when you didn't have to be a hospitalist or an intensivist. I did all that stuff. When I offered to volunteer for COVID in New York State, they were interviewing me, and they were like, "Do you know how to put an A-line in?" Yeah. Can you intubate? Yeah. You manage a ventilator? Yeah, no problem. Yeah. How about pressors? Yeah, do all the time. They were like, "Or you're a hospitalist, right?" Like, no. I just did all that back. That's when we did all that stuff. I was very good at it. Now we've been sort of pushed out by these hospital, trained people. So I've been doing mostly outpatient medicine for the last 15 years or so. Alongside of my general medical stuff, though, I ended up working in a psychiatric hospital, ended up running their medical services. So I became very astute in the medical care of psychiatric patients. I was always interested in the brain and psychiatry. And then in 1991, took over their addiction program. I was actually asked to be the assistant director. And the assistant director was like, you're down there all the time dealing with all the medical stuff and the detoxes. And this will be no big deal. You just cover me during the holidays. I'm around all the time. And you got psychiatry covered and whatnot. And then he quit. And then I moved into the position of director. I was like, wow, I got to get my expertise up, which I committed myself to. And that was really just a joy to run that program for 20 years. We had really a Camelot there for a while, just extraordinary team. And we could handle the most seriously ill addicts and alcoholics and polydiagnosed, psychiatry. We were at the crossroads of everything: psychiatry, medicine, family systems, drugs, everything. It was all happening on our unit, and we were very good at it. There was nothing we couldn't handle, I always said, other than if the patient needed a ventilator. Then they'd have to go somewhere else. But otherwise, we got them. We can take care of it. And so those years were me getting up at 5 in the morning and coming home at 10 o'clock at night. And you mentioned Loveline in 96 to 2000. We managed to do that from like 1 o'clock on Friday afternoon to 10 o'clock at night, and Friday and Saturday afternoon and evening. And then we were doing Loveline at night also. So it forced me to come home and have dinner, which was a good thing. And cut down some of my stuff. And I was also doing nursing home and I was doing dementia units. I just had this such a rich medical experience that no one person gets anymore. You just can't, you're not allowed to. You have to get subspecialization training in all these different areas. And so I've had this extraordinary experience in medicine, in psychiatry, in geriatric, in all of it, in dementia, in neurology. And I just want to now just give it back as much as I can. Now all I'm doing on the medical side, day doesn't go by that I'm not doing some sort of assessment or referral for addiction recovery. I mean, that still comes in all the time. But my medical part is really just plain old outpatient medicine, people I've followed for 20 years plus, and just doing more sleepy stuff when it comes to the basic medical practice.
It's been widely described. I don't know that anybody disagrees with it, but I'd love to hear your assessment. We have a mental health crisis in this country. How did we get here? Why are we at a time where there's never been more drugs to deal with it? And maybe that's part of the problem. And we have better diagnosis. Is it better diagnosis, or do we have more of a mental health issue in this country right now?
Yeah, both. There's both. We are at once over-diagnosing. We are also over-jargonizing. People label themselves with things, and we are in big trouble psychiatrically and psychologically. Big trouble. I have grave concerns for how we're doing, and the lack of attention to what is necessary. There's magical thinking about what this is and what's required to get better. And people can get better. These are treatable conditions. And the fact that we're not doing something, I know exactly what to do for the homeless. I could design a program in 5 minutes for you that would have at least half of these people back and functioning, thriving, working.
Are you going to run for mayor of LA next election?
I don't live in LA. I thought about it for a minute. But it would be impossible because the state laws prevent us from doing these things. And if Newsom has finally started talking in a direction that makes sense about needing hospital beds, about requiring people to get treatment when their brain isn't working right, about taking care of sick people. He 2 weeks ago, first time he brought that up, and I was like, "Oh man, I'll vote for you if you go that direction. I don't care who it is. This insanity has to stop." And he just
who's closer to the answer? Is it the right or the left?
The activists are a million miles from helping these people, so I guess they're on the left. The laws are the problem. If you tell my patients there are no consequences for using and you can steal to support your habit, they're going to die. They're going to die. and that's the laws. And so the people who have created those laws, I'm guessing that's more progressive types, are literally committing murder, and that is murder. In my opinion, it's homicide. It's negligent manslaughter. And I've gone up to Sacramento and said it out loud. I've screamed it from the mountaintop, and they don't care. They don't care. It's all what matters to these people is ideology. They don't care about the consequences of what they're doing. And of course, I become a student of history now because of the situation we're in. And you can see it over and over again. Whenever ideology prevails, humans suffer. That's it. Every time. Whatever the ideology is, doesn't matter which side it's coming from.
Is there a city, a town, a state, a country that is doing this right, as far as you're concerned?
I have noticed that when I go to South Florida, people are so happy and they are thriving and they are industrious. It's so different than the rest of the country. It's palpable. So I feel like something's going right in Florida. But I talked to a gay nurse yesterday, a really great guy, who 15 years ago was put in a what do they call it when they try to pray the gay away? He was put in
that conversion therapy.
He was put in conversion therapy, and those apparently exist in Florida. I'm like, well, it's not all good. things are good and bad, and this is true of all over the place these days. I don't know. I'm so concerned about the lack of understanding of the history and the purpose of this country. That's what I'm concerned about right now. So anybody that's paying attention, I'm feeling like they're moving in the right direction.
So what is the Dr. Drew multi-step plan to helping to resolve the homeless mental health issue in this country?
Oh, it'd be easy. I could set up a 1,500 bed unit right now, and I would have a straight drug unit. I've had a dual diagnosis unit, and I have a predominant mental health unit. I know exactly what kind of nurses to hire. I know how many psychologists we need. I know how many psychiatrists we need, and we could just go do it right now. We would need the authority to bring the people in to help them, and we could have them out and then what we'd do from there, we'd have them out in about 2 to 3 weeks. What we would do from there is set up these sort of residential programs that are about independent living, about learning to work, and about socializing, and having community mental health sort of supportive services in there, and mutual aid societies. It's called the Trieste plan. We know it works. It's been done forever, and the notion that we are forcing people into care or institutionalizing people. This is the part that One Flew Over the Cuckoo's Nest was not a documentary. That's not how even we were doing it then. And B, we're closing in on 75 fucking years ago when that book was written. Okay? Nearly 100 years ago. Do you think we do things differently now in medicine? Do you think psychiatry has moved forward a little bit? Little bit. Yeah, a little bit. So I'm furious at that stuff that they let and by the way, anybody that wants to take aim at the history of psychiatry, I'm with you. There have been excesses. There have been problems. It has been a mess. And yeah. I used to walk by the Scientology museum of whatever they call it, which is sort of Museum of Psychiatry. And I look at it and I go, yeah, they got a point. It's not false. What they're saying is absolutely true. I'm not sure I want people to go the direction they've gone, but they're not wrong about history. And the psychiatric hospital I worked at was like a museum of psychiatry. It was I got all the leftovers from psychosurgeries and various kinds of shock therapies and stuff. It was just bad, terrible what they did to people.
Well, and even today, I think it's still true. We lead the world in antidepressant use. 1 in 6 Americans are on the drug. Yeah. The latest stat. It rose by an estimated 20-25% during COVID. Zoloft is now a top 10 medication. Yeah, so for a country that diagnoses depression and is number 1 in antidepressant use, is that the problem? The over-medication?
Is that the problem? Well,
sorry, one of them.
My peers don't medicate people because they're not suffering. People are suffering with mental illness. The problem is there are 2 standout issues for me when I look at that data. A is, I'll tell you a little story about A. When Sigmund Freud hit the shores in this country and got off the boat from Austria, a mic was put in his face, and the reporters asked him, Dr. Freud, what do you hope to achieve here in America? And he said, well, I hope to gain an increased understanding of bona fide mental illness versus ordinary misery. We have lost track of ordinary misery, not only in the sense of our willingness to tolerate it, but its benefits. It's good for us. It's good for us to struggle. It's good for us to find our way through.
This actually brings up my favorite line from Louis C.K., the comedian. Like, it's okay to be sad. Sit with your sadness.
It's okay to be miserable. It's okay to have a few minutes of trouble functioning. But if you are really in trouble where you can't function, lose track of reality, in harm's way, okay, now we got something going on. That's mental illness. But even then, people should be encouraged to, not label themselves as broken or inefficacious. They need to move through it, move on.
What's the line there? What's the rule of thumb there between being sad and knowing that functioning, more serious,
functioning, being able to function, and people can get a little groovy in their interpretation of what functioning is, because literally we look at work or school, financial status, health, relationships, and what did I leave out? Legal status. And if you have things going wrong there persistently because of some state or using, and you try to change and you can't, and it's getting worse, now we got maybe a problem here. But that's number one. That's my A. B, I am gravely concerned about non-psychiatrists prescribing psychotropic medication. That I worked in a psychiatric hospital for 35 years, and I am loath to prescribe a psychotropic medication without a psychiatric consult, because I am very astute, very well trained in that area, and I know that my psychiatric peers know more and have better judgment. I know what they offer. And the fact that people won't go to psychiatrists, that insurance companies won't pay for that is deeply problematic for me. And we don't have enough psychiatrists. You can't even get an appointment if you do want to go see one.
Wait, just baseline here. Who's doing the prescribing here, and what types of psychotropic meds are you talking about?
Everything. Pediatricians, general practitioners, internists, gynecologists, they are doing the vast majority of the prescribing. And I don't know what the number is, but I'm sure it's at least 70 or 80%. And they should be doing nearly none of the prescribing, at least not without the supervision of a psychiatrist. That is a gravely problematic situation. That's a problem. I about 15 years ago, I went and did, maybe 20 years ago now, did an analysis of my Amherst College, the college I graduated from. The president asked me to come in and look at their mental health services. And it was bad. It was bad. I was a patient in the mental health services in college, and it was just atrocious.
Wait, and that's what led you to the profession, right? That experience?
A little bit. I think it was what. No, I was already going down the medical path, but
you were following the footsteps of your dad.
Yeah, but I was good at science and stuff, and I went off course for a while, and then went back on course. When I was back on course, I was really committed. And it was some of this mental health stuff that sort of caused me to find my way to a solution, because they were treating me so poorly. The treatment was so bad. They actually made me worse. But I remember at the time thinking, there needs to be medical services for adolescents and young adults. We have special needs. They are not meeting my needs. At the time, they just had a retired physician essentially down by the tennis courts, would have office hours 2 days a week or something. That was the medical services for the college. And the psychiatric services were no psychiatric. Well, there were sort of psychiatric services, but really more the psychological services. And the psychological services were literally in the bell tower. They were in the bell tower. And when I got there to evaluate the systems at the college at the time, 20 years ago, they've improved things a lot since then, of course. Still a separation. They had a very wonderfully evolved medical system now with all kinds of great services. Psychological services, still in the bell tower. And they had a psychiatrist there 2 days a week. But again, it was being sort of managed, but there was no integration, no understanding that the brain and the body are the same. They're part of this. This is an organ in our skull. This is an organ in our chest, pointing at my brain versus my heart. And I remember talking to the medical director, and he goes, two things jumped out at me. He goes, like something like 60% of our kids are on psychotropic medication. And I was like, wow, that's, and he goes, yeah, I've got to refill all these psychotropics every year. I'm just refilling. I go, do you contact the psychiatrist? Do you make a plan with the psychiatrist? He turned white. He looked at me like, no, I make no contact with the psychiatrist. I just refill. That's inadequate health services. Okay. He knew it. And then he said, he went, yeah, we got all alcohol on campus. It's a problem, man. He goes, yeah, we had a kid last night. He went over. He had to be shipped out to the ER. It's a 0.3 level. They put him on a breathing machine. And, and he came out. He's okay now. And I go, and I just said, did anybody make a psychiatric referral? Did the kid's got alcoholism? We referring it? No, he's going to keep drinking. Yeah. Okay. There's a near-death alcohol experience, near death. And we don't make a referral to a mental health professional. That's the insanity of all this. And it's better now. Trust me, it's better now. But that's from whence we have come.
But I want to go back to the point about not knowing how to live with just being sad.
Ordinary misery.
Yeah, ordinary misery. It's very hard these days.
What's
Dr.
very
Drew.
hard? Life is hard.
On Instagram and TikTok, everyone is happy and doing amazing things.
Well, that's another problem, which is this is borne out in the literature over and over and over again. And it goes all the way down to capuchin monkeys, primates, okay, but humans especially. Very happy. They can be extremely happy with their life until they see somebody else with more, okay? Then they get unhappy. And so social media has done lots of that for us. Do you know the famous capuchin monkey experiment where they're giving these two monkeys, I think it was a carrot, they taught them to do things, and they started rewarding them with carrots, and they were in parallel cages. And then one day they started rewarding one of the monkeys with grapes as opposed to a carrot, which is a significant bump up in the reward. And the monkey getting the carrot started throwing the carrot back and refusing it. So literally primates will refuse a reward if somebody else is getting a bigger reward. And this is borne out in the literature everywhere in all different kinds of ways.
All right. So we're still not that far off. I mean, I think we share like a pretty significant percentage of our DNA with the primates. So. Oh yeah.
We are primates. It's the chimpanzees that we're, the bonobos and things that we are. But to be fair, I always caution against those kinds of, sort of observations, which is that yes, we differ from chimpanzees by about 200 base pairs, but if they're placed to certain areas, that can be the change can be massive from one species to another. And I will remind you that you and I differ from females by an entire chromosome. Forget 300 base pairs. We have an entire chromosome that they don't have. So of course there are going to be differences.
We have a lot of parents listening to this podcast who have kids, teens, as we talk about social media, et cetera. What are, generally speaking, as a parent, how do I know the line between my kid being bummed out about something and having a larger issue? How do I ride the line between they're going to experiment with drugs and friends, et cetera, and we have a problem here?
All right, so here we go.
Yeah,
let me answer a couple of those things. First of all, in terms of the drugs, you need to have a zero tolerance policy. You cannot, adolescents, their brains aren't geared towards sort of things are okay here or there. Then they become fine everywhere. You have to have zero tolerance and understand there's going to be transgressions. They're going to try stuff, and you need to be an executioner when that happens. You're not to get angry. It's not about you. You tell them what the consequences are they're going to be if they do things, and you drop the axe when the time comes. Not angry. I didn't do it. I told you it was going to happen. Now it happens. If you are finding drug paraphernalia on the child's room, on the child's person, in the child's backpack or something, you have a major problem. If they're getting that sloppy that you are finding the evidence, now it's time for referral. 100% of the time. I'm almost never wrong about that. You have a major, major, major problem. At least underway. It may not be dangerous yet, but you have something that is not a parenting problem any longer. On the mental health side, the easiest sort of barometer, the one with the greatest accuracy and predictive value, is a sudden full drop in grade from A to a B, B to a C. If a child is performing well and then all of a sudden falls out of bed, that is a mental health. That is not a parenting problem. That is a mental health problem. That is typically depression, most common thing, but can be obviously many, many other things. And of course, there are things you can look out for. There are sort of, the problem with adolescent mental health is essentially any mental health illness sort of manifests all the same. They sort of have a limited spectrum of symptomatology. They don't sit around crying. They don't complain about grief. They don't complain about depression. They change their friends. They change their eating habits. They change their sleeping habits. They change how they dress. They start wearing black nail polish. They change their appearance, in terms of makeup or hair or whatever. This is hints that something is afoot.
And do you have a general philosophy on to what extent? I mean, I think parents are also struggle with how much to surveil their kids, right? How much to give them privacy.
I think that is an anachronism of our generation. I think you're the parent. You purchased these things. They are yours. They're not the child's. If I would say the one thing you might want to give them some room on is something like a diary. If they want a private place to put their thoughts, fine. Everything else, that's yours. Of course. What are you talking about? That it's odd to even contemplate that you wouldn't want to care about what your child is doing and pay attention. If they're out in the world sphere. That would you not want to watch them if they walk through Central Park and they're 11 years old? You just what are you talking about? But the other bigger question is how much do you limit it? Because we know these screens are having such a bad effect. So I have psychological colleagues that make their living studying this topic. It's all they do. They limit their kids to 2 hours a day, period. And they put tons of, structure on what they can get at and get to and whatnot.
And this goes up to 18, 16?
Yeah. So far, I think she's, the one I'm thinking of runs this group called dcakids.org. And she has lots of resources, information on how to do this. It's very hard to do it unless you have the participation of all the parents, right? Because your kids are just going to grab somebody else's phone or they're going to be shown stuff from the other kids' things. But if you have a community that's willing to do this, and by the way, if you're the only one doing it, it makes it that much harder, right? Everybody else gets, you're living, I can't be a part, I'm isolated, blah, blah, blah. Well, if everybody is required just to use a telephone as opposed to the internet, we could at least roll it back to that.
Talking to kids, treating teens 30 years ago, 20 years ago, 10 years ago, today, what have you seen shift here? How many more challenges are they facing today than
I think the trauma part is settling down. I've seen that significantly reduced. What our world governments did to 8 to 15-year-olds in particular is something a wound they're going to carry the rest of their lives. I hope they turn it into fury. They should be furious with what was done to them. And they should make sure that governments don't do that to anybody else.
The lockdown
comes up. The way they did it, 2 years of, shelter in place. And then here's your school on a pad that mostly is getting sexting and pornography. And kids it just was a terrible, horrible, and so predictably in terms of doing risk reward analysis, you could predict it so reliably. They should be furious, and if they turn it into sort of solutions and being efficacious with moving forward, it could be a net asset, but it's going to be an injury that they carry forever. Indeed, the family breakdown is at the core of the issues. Children, the reason we have families is because that's the optimum way to raise healthy children safely and with optimum mental health. What a family is, I don't claim to know, and I don't care. I just need a stable unit. I know that I couldn't have done it as a single person, and that's not to disparage single persons. That's it's just you need manpower.
Mm-hmm.
When you're raising kids, you need lots of manpower, and I couldn't have done it alone. Impossible, not even remotely possible.
Well, it's interesting to hear you talk about COVID now, because very early on, you were one of the people saying, "Calm down.
Yeah.
you got a whole bunch of pushback.
Oh my God, yes, yeah,
you
and I, you know, like anybody, I didn't say everything right, and in fact, what's comical now is the people. I think people are getting a better understanding that what people say in media about public figures is never the truth. What people say on social media is what somebody said, never what you said. Never. It's never what you said. What goes viral is never what you said. And in that case, what was going viral was some video that somebody put together. We still don't know who. There will be a libel action one day. And he cut out what I said at the end of every one of my comments, which were it have been left in, it would get me in trouble today. Which was, I would say, calm down. We've had this H1N1 thing just 10 years ago that killed 300,000 people, and you don't even know it happened. So isn't there an intermediate sort of zone we can get into here with how we react to this one? It's going to be bad. It's going to be a lot of people hurt, but there's ways to do this without going crazy. And then I said, just listen to the CDC and listen to Dr. Fauci. I've been following their advice. Fauci's my hero.
You went back with Fauci.
Pandemic.
Yeah.
I every time I would say that at the end of every one of my comments, listen to see, listen. And if that had been left in all those little tapes, that's what people would condemn me for today, because turned out they were a little adulterated too, and they weren't right on everything.
What do you think? Well, you know, I've been watching as a journalist as like we've lost trust in the military, the FBI, the CIA, the CDC, the FDA, the Supreme Court. But it was remarkable, you know, because you went into COVID, and I think for the most part, people are like, okay, CDC, FDA, you know, people who weren't really scrutinizing them, like I tend to believe what they have to say. One of the few agencies left, and now we come out with a completely different feeling. Many people do. About them, the World Health Organization, etc. What did the so-called medical establishment, I hate that term because it's probably like saying the media, learn? What did they get fundamentally wrong here? And have they learned some lessons from the experience of the past 4 years?
We are still working through it, I would say. There is no consensus, I would say. We have learned that there are some issues. That's what we have learned. And we are not yet fully reckoned with it. We have not. The coziness of the FDA's relationship with pharmaceuticals and the back and forth with employment between a regulator and an executive at a drug company, I was not aware of that. That's a problem. And that's in many industries, in military, all kinds of things. We got a problem. So that's an issue. The fact that most physicians are now employees, we weren't really aware of that, and that they started listening to their employer, and the fact that that is really part of a historical arc of physicians losing their ability to function. So now, because of insurance companies, because of hospitals, because of employers, we don't make decisions autonomously anymore at all. And I've been fighting that my entire career, and I have realized we've just lost that battle. It's just over that way. We have to find creative ways to get the empowerment to the patient, get things into the hands of patient, the ability to access care for reasonable price, access medication, learn about what their healthcare should be and how they should approach it. And I see Mark Cuban doing some of this stuff, and I'm doing it with the wellness company, and we're just doing these things to try to find ways to sort of solve these problems. It's going to take a while. And then things like the bureaucracies of the CDC. Now, the FDA, again, you got to remember, I remember I had a nightly television broadcast on the local Fox affiliate here during COVID, and there were a couple of standout moments. But one was when my co-host, the anchor, goes to me, goes, well, what about the FDA? I go, the FDA has nothing to do with the practice of medicine. Nothing. They determine companies, what they can bring to market and what conditions they bring it to market and how they can market those things to us.
Yeah.
They have no impact on what doctors choose to do. We do what's in the best interest of our patient. I've trained doctors in medicine, psychiatry, adolescent medicine for decades. Never once did I say, what does the FDA say? Never once. That they are unrelated to us. But turns out they're having an impact on what's going on, certainly an impact on the CDC. what they've done. And then here you have the CDC taking these extreme positions that are not justified, that they have really no data to justify. Shocking. That's just shocking. And then unable to change course. That's the thing I've noticed most. These bureaucracies can't change course.
It seemed like people were looking for absolutes. They were looking for certainty. And then the CDC and the establishment tried to provide certainty.
There's no certainty. No.
In a world where there was no certainty, I remember when the vaccine came out, they're like, if you get the vaccine, you're less likely to spread the thing. That turned out to be among the many
biology. Certainly epidemiology has no certitude for sure, but biology in particular is a giant probability equation. All biology is probabilistic. All of it. If you're trained as a biologist, you learn that's the first thing you learn, is that everything is a result of solving evolutionary constraints, evolutionary problems, and then based on a probability. These are chemical reactions of biochemical reactions that have a direction, like a cloud has a direction in terms of how it moves and evolves. That's how biology works.
So knowing that biology is a probability index, what would have been the better way to talk to Americans, humans globally, about what was happening?
One of the shocking things for me is we learned how to do this during the AIDS pandemic. We learned it. The whole discipline developed. Loveline was sort of one of the disciplines that came out of it. Here's what we learned. We learned that authorities in a box don't change people's behavior very much, particularly sexual behavior. But if you give a relatable source, cases, tell their story, narratives of relatable narratives, add some humor, add some music, add somebody like me to explain what you're listening to. That's it. That is the highest impact of changing health behaviors. Somebody with lung cancer, tell your story. Ooh, and you're like me, I smoke. Ooh, I don't want that. And yep, here's the data. And by the way, bring a comedian along or something to make fun of it, and it gets it in, it gets it digested. We left all of that behind and adopted a policy which until this moment had always been considered grossly unethical, which is using fear to force people's medical behavior, their relationship with their body, and what the advice they take from the medical system. Fear. That
right. If you don't take X, if you don't do X, you're going to kill people.
It's reprehensible. It is unethical. It is disgusting. And the fact that we did that was a shock to me. It was an absolute shock. So the way to prevent paranoia, the way to increase the probability of somebody sustaining a health behavior, openness, fresh air, watch us, as physicians and scientists get to a consensus, ascend to the truth as best we can, open the book, show the process. I worked in a psychiatric hospital for 30 years. When you withhold information, people get paranoid. It's exactly what happens. And then they start coming up with their own theories. You have to open it and
turning to YouTube.
Put it all there. And the fact that didn't happen is just disgusting to me.
Well, and now it's like, I worry about the next one of these where now we're programmed to, I'm not going to believe anything you guys tell me, even if there's truth in it.
The reality is that's actually better. That's probably better. At least you can turn to your physicians and get, and there are sources you might hopefully trust now, and you can kind of build it back. So I don't know. It's all bewildering, weird. I never would have predicted any of this.
Well, and also just the way you get crucified for even questioning things. So, like, since when did
that is disgusting. Also, I mean, to me, the poster child for that was Jay Bhattacharya. This guy is a wonderful human being. He's a consummate professor and decorated scientist, and that's the guy you're going to crush. And guys like him, all right, we got a problem. That's the guys you should be discussing this with.
One more topic I want to get to before we go, and we discussed this briefly over the summer, was psychedelics and the impact, and you're concerned about how they're rewiring the brain. As many people turn to shrooms, they like it. It's cleaner, lighter high. I know people who are doing that instead of smoking marijuana. Right. Big picture, broad strokes here. What are you seeing in terms of that? What concerns you about that?
Right. So I had concerns already because of having worked in a psychiatric hospital all that time. I saw neurological and psychiatric consequences from psychedelics my entire career. Now, I always thought that mushrooms were sort of the least likely to do stuff because they were so mild, but I thought, we're going to see it. We're going to see it. And now the people are using it so widely, We are seeing it big time. Now,
even microdosing.
Hold on. Oh, yes, absolutely. In fact, in and around the time we met, I was talking to somebody who developed what we're seeing from the microdosing, and both from the microdosing and from the mushrooms, which is mania. Hypomania is developing all over the place, both from the how powerful cannabis is. People use a lot of cannabis, get manic, and from the mushrooms and from the microdosing. We're seeing just uncanny amounts of acute manic psychosis. And as I was saying, around the time I was talking to you, I was talking to some people who just developed it from exactly what we were talking about that day, exactly what we were talking about. Now, that doesn't mean these things won't have use. They will have use. There's no doubt in my mind that psychedelics will have therapeutic use. They absolutely, categorically, on the record, they will be useful. We have to understand how to use them and what the harms are. We are not there yet. And nobody should be treating themselves for anything. I don't treat myself for anything, and I'm a physician. I'm trained to treat people. You don't treat yourself. You don't treat your family. You can't be objective about your own medical and psychiatric conditions. So the very premise of I'm going to use this to feel better or get better, that premise is so profoundly flawed. Now, people are so distrustful of the system and stuff. I understand why it's developing. I get it. I'm sympathetic to it, but is at its foundation flawed. And then in terms of being able to know what's going on, we are not there yet. We will be. We'll be there.
Marijuana. Your daughter has shared extensively about her weed addiction, her recovery. And marijuana today is different. How is it different, I should ask, than it was 10 years ago, 4%, 50 years ago?
Like 5% cannabis to 100% cannabis concentration. It's a different, things are happening that from the drug that I just didn't anticipate. I've been caught off guard by, including its, most people that develop cannabis addiction in my world would sort of go on to something else. Now the cannabis addicts stay with cannabis because it's so powerful. They can stay right with it.
I remember growing up, people were like, oh, you can't get addicted to weed. I mean, is that out the window at this point? Are people still arguing against that?
Talk to my daughter.
Yeah.
You can talk to her if you want. I've treated so many cannabis addicts. It's ridiculous.
Is it because of how potent it is now?
Yes. That's why we're seeing it there. Like I said, it used to be something much more, people could kind of drop it without treatment and they could let go, or they would go on to something else. That's sort of typical. That's why it got the label of the gateway drug, because people would sort of burn out on it. It would have, the efficacy would wear off. They'd get some depression. They'd sort of start experimenting with other things, and off they'd go to other things. But now they're with the weed because it has such power over them.
And it's interesting looking at it now. I'm curious. I grew up with the Nancy Reagan "Just Say No" campaign. Have we gotten better at talking to kids about it, at dealing with it, at being proactive?
No. There's still like I said, when we legalize stuff, I'd hope we would start to be able to talk about things honestly. No. We're not there.
Yeah, we're at almost half the union now, half the states. I think with the latest voting out of Ohio,
it'll go all the way. But we're still not. People are not allowed to talk honestly. Even doctors are not allowed to talk honestly about what they're seeing, about how it's affecting people.
Why aren't they?
Well, because it violates the. How dare you? How dare you? You don't know what you're talking about. What about alcohol? It's worse. Yeah, alcohol is worse. Yeah, it is.
So alcohol is worse than marijuana.
Yeah. In terms of impact on health and society, absolutely.
Right.
100%.
And we can talk about that, but because it's trendy, it's not politically incorrect. I know. What's your assessment of why so many doctors feel
it's a protected molecule? You're not allowed to. There's no such thing as a good drug and a bad drug in my world. They're just chemicals, these molecules, and how they affect humans. That's it. But we have all these weird ideas about them being good or bad, or it's just ridiculous.
All right. So we talk here at the end of 2023. People make New Year's resolutions. Everyone's going to have different things that they're probably looking at in their life. Dr. Drew, what is the key to what sorts of things, if people want to have an impact on their health, on their lives, are things they should be considering making resolutions about for 2024?
Yeah, I'm getting very involved in sort of weight loss and diet and stuff. And I just think we just don't do enough to help people get where they need to go. And, if you don't take care of your body, it's hard to take care of your brain. It's, hungry, angry, lonely, tired. These are the things we used to always tell the addicts. Like, you got to take care of those things first. And if you're feeling good about yourself and you have adequate stamina and you're getting adequate sleep, then you can start to work on your brain and from a position of wellness. And the thing I would tell people, there are kind of two things in terms of whatever the changes you want to make. Support of other people is really important. It just is just very important to have some source of some human something that keeps us going. It's why coaches work and things like that. And the other thing is that, change is hard. I can't get people to take a pill twice a day, let alone lose 30 pounds, right? I mean, people don't understand how much humans don't like to change and won't change, and just basic behaviors. So acknowledging it's hard, plan for change, executing change, but where people usually get into trouble is maintenance of the change. Maintenance is the key thing. And maintenance is a daily process, whether it's checking in with somebody, whether it's, doing a certain number of whatever it is you want to do with yourself. It's being conscious, being structured, having support, and maintaining and turning into these things into lifestyles, not into just moments of change.
Curious, since you mentioned weight loss, I mean, we've had this whole body positivity movement. At times, some people are ridiculed for even bringing it up in the media. Has there been a correction on that yet? What's your sense? I mean, you're pretty outspoken about this stuff.
Yes, I think there is some correction. At least you can start to talk to people who want to change. I'm not telling people they have to change. I want to change. That's my general thing. I don't want to force anybody. People want to keep doing drugs, do drugs. I don't care. But if you want change, I can help you. That's always my thing. I think Oprah on Ozempic is a crossover moment. She admitted a couple of days ago to being on Ozempic. That's a moment.
Why?
That's going to change things. I don't know. I don't know why. I don't have a full sense of it yet, but there's something about that felt like, we've moved somewhere now. We've moved into a different place.
The Ozempic conversation's been interesting. The evolution there, from it being the secret thing to people being like, no, I'll talk about it.
And then shameful. And then now Weight Watchers is offering it as their main therapeutic intervention. But then Oprah admitting it, that I don't know. It makes weight loss more of a something that needs attention, systematic attention, and some people pharmacological intervention. It's a thing, and she's sort of acknowledged that it's a thing. It's not about willpower, and it's not just it's more complicated than that.
Dr. Drew, to be continued. We'll follow up on the Oprah thing when we figure out exactly the impact it'll have on America, along with everything else. Where can people listen to you, read you, watch you these days?
I want you to go to the main thing. My wife Susan, sitting across from me, is a show she produces. It's usually Tuesday, Wednesday, and Thursday at 3:00 Pacific. We move it around a little bit. It's called Ask Dr. Drew. We became like the French underground during the COVID epidemic. I was just trying to give information to people and calm them down, and we ended up becoming a place for people who have been canceled to be interviewed, so we can see what they know or what they said or and I've learned so much from every one of them. They all had, I didn't agree with everything every one of them said, but I learned something important from every one of them. And so we are still there sort of as a outlet for information and discussion and for consideration. And we have Rob Schneider's coming in here. We have all kinds of interesting people coming. We have Claire, this doctor that John Campbell interviewed, this pathologist from England, really interesting woman that sort of threw the BS flag early in COVID, has had some great observations. A lot of interesting people. And
this is on a podcast.
It's a streaming show live, 3:00 Tuesday, Wednesday, Thursday, and then it goes up as a podcast and also a YouTube channel. Go to drdrew.com for all of it. There's a bunch of other podcasts I do there as well. Still work with Adam Carolla, do a podcast with him. And drdrew.tv will give you a blast on the streaming show.
Thank you, Dr. Drew.
All right.
Happy early New Year.
Cheers.